Right, so welcome to any newcomers that are here tonight for the first time, and hello to all of our regular attendees. This is actually our fifth seminar in our series, Turning the Tide on Climate. Last week we talked about climate economics, and tonight our subject is climate change and health. My name is Clark Mackey, and I'm co-hosting tonight with Jude Larkin. So we ask you to type your questions into the chat during the Dr. Vakil's talk and also afterwards, and Jude will read the questions to Cathy at that point. Cathy will talk probably for about 15 or 20 minutes. The seminar is being recorded, and you can check the 350 website for the link probably a couple of days after this seminar. And there is our email if you need to get in touch with us for any reason. Let's just take a minute to think about and acknowledge where we are on traditional Anishinaabe and Haudenosaunee territory. And to acknowledge the fact of settler colonialism, and to think about this, especially in relation to the kinds of conversations that we've been having as part of this series relating to climate change. It's my pleasure to welcome Dr. Cathy Vakil to present tonight. Dr. Vakil is an award-winning family physician in Kingston. She's affiliated with the Queen's School of Medicine. She has had a long-standing interest in health, the environment, and climate change, which means that she was a board member for the Canadian Association for Physicians for the Environment and Physicians for Global Survival. Welcome, Cathy. It's a pleasure to have you here tonight. I'm just going to stop sharing my screen, and you should be able to take over.
Okay. Okay, can you see that? The PowerPoint?
Yeah.
Okay. So thanks, Clark, and welcome everyone to the topic tonight, which is climate change and health. A lot of people don't realize how climate change does affect health. It's actually quite a big topic, and I've had a bit of trouble fitting it into just a few minutes. But for sure, climate change does directly and indirectly affect our health. In fact, all environmental issues are health issues. We can't separate ourselves from the environment. We're part of it, and planetary health equals human health. Oops. Okay, so climate change is a health issue. Here are a couple of quotes. Climate change is the world's most urgent public health problem. That's the British Medical Journal. Climate change is the defining issue for public health in the 21st century. That's from Margaret Chan, who is the head of the WHO. The reason I picked these two quotes is because they're at least 15 years old. So we've known about climate change as a health issue for decades now, and it's really only recently that we're even recognizing climate change as the emergency that it is, and as the public health emergency that it is. So this slide, I'm going to keep coming back to it because it just encapsulates basically most of the health effects of climate change. And I'm going to talk about each of these sections a little bit for each of them. So the one I'm going to start with is heat, which is the purple, pinky purple one up to the left there. So we have more intense, more frequent, and longer heat waves in the summers than we have ever before. The winters are getting warmer, but our summers are getting warmer too. So this causes heat illness, and most of us, we would call it heat stroke, which is, you feel kind of dizzy and you feel unwell and a bit sick and tired when you go out in the heat too much. You need to get you need to cool your body and you need to get rehydrated, and then you're fine. If you are unable to do that, you will go on to what we call heat exhaustion. And if you still can't cool your body and rehydrate, you will eventually die of it. And this has been happening more and more frequently, even in developed countries. So in 2018, there was a heat wave in Montreal. For 8 days straight, the temperature was more than 40 degrees centigrade, and there were 66 deaths from that. In Ontario, the same heat wave, there were 86 deaths. Now, I don't like to throw out numbers and stats because you really need to know where they come from and how they were arrived at, but I will be doing that anyway. In Toronto, it's estimated that there are 120 deaths per year from heat waves. In 2003 in Europe, there was a huge heat wave over a couple of weeks. They estimated about 35,000 people died. And that's not to mention all the naturally hot regions of the world where there are massive cities with huge slums and shanty towns. And when they have a heat wave, unmeasured numbers of people are dying. So the people at risk are older adults, people with cardiovascular disease, mental illness, people who are socially isolated on reduced incomes, who don't eat well, those who have neurological, respiratory, and renal disease and diabetes, and people on meds where they are less able to control their body temperature, where they're dehydrated, where the medication dehydrates them and maybe would lower their blood pressure. So these are all people that are at risk, as well as people who work outdoors. The other thing about heat, and I'm going to talk about this in a bit, is that it increases air pollution. It also causes drought, with food insecurity, threats of clean drinking water. It contributes to wildfires, which causes smoke inhalation, more air pollution, water pollution, mass evacuation. All these have health effects. And we know that chronic inhalation of smoke causes low birth weight babies, increase in stroke and in heart disease. Heat also causes warming of the oceans and reduced diversity, reduced fish stocks. So commercial fishing is threatened, as well as food supply for a lot of the world. Here's a quote, or here's a number. By 2050, the maximum temperature of the warmest month in Toronto will be 5.9 degrees centigrade higher than today, which is almost 6 degrees, which is pretty staggering. So the next section is severe weather, and we're all very familiar with the big weather events, especially last week in Texas, a big snowstorm. So directly, people are injured and killed from debris that falls from wind, collapsing houses, falling trees, that kind of thing. They drown in floods. And in Texas, and in a lot of these weather events that happen in the winter, invariably there are people that die of carbon monoxide poisoning from trying to keep warm in their cars, and they die in fires. Like there was a family that died in Texas they were trying to keep warm. They died in a fire, hypothermia, and then people who lose their homes and then need to be evacuated. So all of these cause health issues. Next, I'm going to talk about air pollution, and this is a really huge topic. So air pollution is caused by the combustion of fossil fuels, mostly from transportation and industry. In combination with sunlight and heat, that produces chemicals, particulate matter, which are little pieces of dust that have chemicals attached, ground level ozone, which is a potent lung inflammatory, and oxides of nitrogen and sulfur, and other toxic chemicals as well. So we know that air pollution causes chronic obstructive lung disease, asthma, heart disease, lung cancer, stroke, infertility, premature birth and low birth weight babies, delayed and stunted lung growth of children, and increase in lower respiratory infections. The particulate matter, 2.5 microns, which are really, really tiny, you can inhale them and they will actually go into your system and deposit in your organs. And there's possibilities and research into them causing diabetes, ADD, autism, neurodegenerative disorders. Also, the people at risk for air pollution are also the same people at risk for COVID. This is Indigenous people, racialized groups, and low-income people. Other vulnerable people are the elderly, children, frail, anyone with respiratory cardiac disease or diabetes, anyone who already lives near high traffic areas or who work outdoors. In Canada, the estimate is 14,400 deaths per year directly due to air pollution, 7,000 of those in Ontario. And I actually think that's probably higher if you actually look at the indirect deaths. It's also been said globally, there are about 4 million people that die directly from air pollution every year. But a study that came out last week from Harvard estimates now about 8.7 million deaths per year. Importantly, when we reduce fossil fuel use, we also reduce air pollution. So getting back to our chart here, the next thing is vector-borne diseases. So these are diseases that we get from things like mosquitoes and ticks. So malaria is a huge one worldwide. It's estimated that, I think it's, there will be, by 2030, 60,000 additional deaths per year worldwide from malaria. I actually suspect it's going to be a lot more than that. And then by 2050, there will be 200 million more people at risk of malaria because it's transmitted on mosquitoes, and the people that the mosquitoes have access to will increase because of rising temperatures worldwide. But what I really want to talk about, because it's more important here, is Lyme disease. So Lyme disease is carried on ticks, and we didn't really used to see it here a number of years ago. But because the ticks now, our winters are warmer, they live through the winter, more of them. And so much of southern Canada is now endemic to Lyme disease, and eastern Ontario is definitely endemic to Lyme disease. And anyone who works in healthcare will tell you that we never used to see Lyme disease, hardly. Now we see it regularly. So it's increased about 5 times since about 2012, 5-fold. And there are 3 stages of it. So there's early localized, and that's when that's within 30 days of getting a tick bite. So here it's the nymph ticks. They're tiny, tiny little ticks. Even when they're engorged there and they've been on for 24, 48, 72 hours, they're hard to identify, and you may not know you've been bitten. So, but you might get fever, feel a bit unwell, maybe some muscle pain, that kind of thing. And then if you get diagnosed, you get treated, antibiotics for 3 weeks. If you're not treated, and the other thing is the classic bullseye rash, but only between 10 and 80% of people, depends what you read, will get the rash. So if you don't know you've been bitten by a tick and you don't get the rash, you may well not know that you have had Lyme disease. So you might go on and get the early disseminated, which appears weeks to months after the initial tick bite if it's not treated. This is manifested with carditis, which usually manifests by heart block. 15% of untreated Lyme disease people will get neurological issues like encephalitis, meningitis, neuropathies, Bell's palsy, that kind of thing. 60% of untreated Lyme disease, they'll get arthritis. So if you don't get treated at that point, you may go on and get late Lyme disease or chronic Lyme disease. That's months to years after the initial bite. So it's arthritis and some quite significant neurological issues. There's also this entity called post-Lyme, and this can occur even with people that have been treated, and it's a chronic pain, chronic fatigue, sort of cognitive problems. And the biggest problem with all of this is that if you don't know you have it, you will not get treated, and you may present late and be not as treatable. There's also a huge controversy, which I'm not going to get into, about the testing for Lyme disease. There are people that think that the criteria that defines a positive test is too tight, and that we are missing people and they're going undiagnosed. It's a huge controversy, and I'm not going to get any more into that. But the issue with Lyme disease in the long term is that if we have way more of it, there's just going to be more people that are going to be missed, and more of the chronic persistent Lyme disease, which is quite debilitating. Next, allergies, not particularly problematic, but more heat causes more allergens. In the UK in the past 30 years, it's been increased by 20 days this season. Of course, it's an issue for anyone with allergic asthma as well. So moving on to waterborne diseases, these are cholera, other kinds of infections, mostly due to floods and drought that affect the that contaminate the water. An example of this actually is what happened about 20 years ago in Walkerton, which is a small town northwest of Toronto, where E. coli got into the water system. 7 people died, and a number of people were chronically ill and remain chronically ill from it. And this was E. coli from the local cattle, like it's a rural area, from the cattle manure, but it also is partly due to several huge rainfalls which washed the E. coli into the water system. So it was partly due to climate change. The next section is environmental refugees, which globally is a huge issue with rising sea levels and people in coastal areas getting in floods, their whole entire villages, entire communities getting washed away, forced migration. And an example of this also is Syria. So this is a Syrian refugee camp. And of course, it was prompted by political instability, and that created massive refugee problem. But there was also, for 5 years prior to this, a 5-year drought where a lot of rural people, like 1 to 1.5 million people, moved into the cities, and along with the political instability, caused the refugee crisis. Let me just add these here. So this is just another slide showing this. Climate change causes food insecurity, forced displacement, increased gap between rich and poor, civil unrest and resource wars, and then sexual violence, trauma, armed conflict, and refugees. Then there's mental health. There's all the mental health issues that go with all the other problems that people have. But also there's this new kind of diagnosis called climate anxiety or eco-anxiety. This has got a lot of press in the last couple of years, particularly in young people. And it's a sense of depression and despair and powerlessness and fear about the future of the planet, largely due to climate change and other environmental issues, to the point where some young people do not want to have children because of this. And I think this is the tip of an iceberg of a massive mental health issue that we're already seeing. Now, the last thing here is water and food supply. So we've already talked in the first seminar about the food supply, which was done extremely well. But just to say that half of all pediatric deaths worldwide are associated with undernutrition. So it's a massive, food insecurity from climate change is a massive public health issue. I also just want to mention about climate change and gender and health. So in many parts of the world, in a family, it's the girl's role to go and fetch water and to fetch firewood. And with climate change, sometimes these girls have to walk farther and farther and farther away, sometimes spending many hours a day collecting them. And what happens is they then get pulled from school. Also, in families where there's droughts or floods and their food supply goes down, in a lot of families, they don't have enough, there are too many mouths to feed. So they will marry off or sell off the daughters. And these girls then get pulled from school and they begin to have early pregnancies, larger families, no education, no power and control in the family or in the community, poor nutrition. And there's a whole entity called, I think they're called child brides of climate change. And this is happening in many communities. And we've known for decades and decades and decades that the answer to many of the global problems is to educate girls. And in many areas of the world, this is actually regressing. And there are fewer girls in school than there used to be. The other thing is that the refugee camps I mentioned, there is a lot more sexual violence. Women and girls are a lot more risk of sexual violence. I have read it's 80% in some of these refugee camps. I've also read it's closer to 100%. And also with weather disasters, the men don't feel as in control and it increases violence against women. So this is just a map. The top shows basically which countries are the most responsible per capita for greenhouse gas emissions. The bottom map shows the mortality per million due to climate change, and it's exactly the opposite. And this brings up this whole issue that has been talked about as to which countries should be responsible for reducing greenhouse gases, because it introduces issues of fairness. So I'm going to get on now to solutions. This is an interesting slide. So it's looking at the particular professions and how much the public trusts them. So this is, not surprisingly, the top is nurses. Doctors are up there. Teachers and judges and scientists are up there as well. So these are people that through their work, they do good, and the public does not perceive they have any personal vested interest. Interestingly, at the very bottom are politicians. So this speaks to me in that I think that healthcare workers, because the public trusts us, we should use that influence and try and change policy for environmental issues. So in terms of solutions, there are two ways to look at it. One is adaptation, which is adapting to the warm climate. So it's basically the health issues, for instance, that I've talked about, they're basically the symptom of the problem, which is climate change. So there are some medical things that are already happening that we can do to adapt to these health effects. Mitigation is trying to stop the problem. It's preventative medicine. It's trying to reduce the greenhouse gases so there is less climate change. And in fact, it's like, as I say, it's prevention. But these are not medical problems. These are policy and political issues. So in terms of adaptation, we need to be educating doctors and nurses to recognize early Lyme disease, for instance, and have it on their radar when people come in with sort of vague symptoms. Could this be untreated Lyme disease that this person acquired in the past? So just having those things on their radar, thinking during heat waves about the patients that are at risk. The public health units are already doing good things in terms of heat waves. They have cooling stations. They sometimes have identified a vulnerable population, and they have sort of set up pairings so a neighbor or a relative will go in and check on an elderly person who's at risk during a heat wave. Also, there's the air quality index, which is, you can look up along with the weather, and it's a metric of the smog, basically. And it will tell you, especially if you're in a risk group, whether you should go out or not during a smog day, or in the morning when the smog is less. Don't exercise if you have certain problems. So these are all ways that we have adapted to a changing climate in terms of health. But I also think that environmental issues in general need to be part of the curriculum. And certainly in medical schools, they are not. So in terms of mitigation, as I said, these are really, it's really political, trying to reduce greenhouse gases. Now there is two ways to look at it. One is the personal, and one is the systemic. The personal we have already talked about in these seminars, things like just reducing our ecological footprint, each of us. So using active transportation, walking and biking, eating less meat, all these also have health benefits, less diabetes, less heart disease, and less cancer. So it's a win-win situation for that. Those of us that have money, we could be divesting out of fossil fuels so that our money is not being used for these industries. Also pressuring our professional organizations and our pension plans, et cetera, to divest. We're also all voters, and we can pressure politicians to make changes that will affect positively the environment and climate change. And I also think that we need some kind of electoral reform, because right now, all sorts of people with all sorts of good ideas have no representation in Parliament. So we need some kind of proportional system. We're also consumers, so we create the demand for products that are easier on the environment with less of an ecological footprint. But I'm also wary of spending too much time and people spending too much energy on the personal, because I think it's our government's role to facilitate that and make it easier. And sometimes it's not very easy. So we can tell people they should be biking to work all the time. But if they are taking their life in their hands because of the traffic, and we're doing better in Kingston now, we have a few bike lanes, but it needs to be made easier. We can tell, we need to put money, like we say people shouldn't buy big gas guzzling SUVs, but I know many people, and I can totally understand it. They don't feel safe on the 401 with all those massive tractor trailers. And so we need to beef up the rail, get goods moved on trains so we can take all those huge trucks, themselves gas guzzlers, off the roads, so that the rest of us can buy little hatchbacks and that are more fuel efficient. And those are things that the government should be doing as facilitators. Just a word about greening healthcare. Healthcare, and it's mostly hospitals, constitutes about 2% of greenhouse gases in Canada. So, and there are a lot of good things going on in terms of retrofitting, lighting, and wastewater, using less energy. And there's whole websites and organizations around greening healthcare. Also, I think that doctors' associations and nursing associations should be speaking out about environmental issues. Then they should have a presence at these international climate change meetings. So getting on to the systemic issues, I think one of the main things we have to do is redefine what constitutes a healthy economy. Basically, right now, our economy is considered healthy. The more stuff we buy, the more it's based on consumerism. And this is a big, huge problem, because this idea that there's endless growth, of course, is unsustainable. This idea that it's environment versus the economy doesn't make any sense. Planetary health equals economic health. The way we measure a healthy economy is now the GDP, which is basically stuff in and stuff out, money in and money out. It does not take into account the things that we actually value, like what is the poverty rate, about environmental degradation, the status of women, the unemployment rate, all these things which may not be easy to quantify, but they still constitute, they are part and parcel of a healthy economy, and they need to be measured appropriately. We also need to look at healthcare costs of doing nothing about climate change as part of the costs of inaction. We also need to put the onus on producers of goods to deal with their disposal, the pollution they cause, and the cost of recycling. The planned obsolescence should not be, this has been going on too long, that it costs more to replace a phone battery than it does to replace the phone, those kinds of things. And lastly, we need to be regulating corporations. They should not be allowed to give gifts to political parties. They need to be held responsible for worker safety, the pollution that they cause the workers and the rest of us, and fair pay, so the CEO isn't making 300 times what a worker is paying. We need to bump up public funding for education and health so they aren't forced into corporate partnerships where there are always strings attached. No more subsidies for dirty industries like the fossil fuel industry, promotion of carbon taxes, wealth tax, the Green New Deal, which I'm not going to get into because that's a whole other seminar in a few weeks, the just transition. So we all need to be connecting the dots on an ongoing basis, including the medical profession. And we have to remember that planetary health equals human health. And as Stephen Moore last week so eloquently described, we have to be a good ancestor. And we have to do what Indigenous people do, which is every decision we make, we think of what the effect on 7 generations from now. So that's all I was going to talk about. So I'm happy to have any questions or have anybody want to discuss anything.
Thank you, Cathy. That's great. There's a lot there to think about. If you could just maybe stop sharing your screen right now so we can see you. And it looks, yeah, that's good. And there is a lot of, it looks to me like there are a lot of questions in the chat. One thing which I'm going to bring up, and maybe you chose not to talk about it, and maybe it's a big question mark right now, but that is COVID, right? And certainly when COVID first happened a year ago, there were people, scientists and epidemiologists and stuff talking about how it was that if in fact it was caused by coming from animals, that one of the problems we have in the world is that we're reducing the amount of wild space there is, and the wild animals have less and less places to live and become closer to humans. There's also the whole question of if in fact it's somehow related to the eating of meat. It's also clearly spread very rapidly because of the incredibly globalized transportation system that we have. So I'm just wondering if you have any comments about COVID in this context.
Well, I looked into this too, and all the things you just mentioned were basically what I found. I don't think it's now felt to be anything to do with, deforestation and drought moving farms closer to forests, so that's hopping between livestock and wildlife.
Mm-hmm.
I don't think anybody really knows exactly where it came from, but that is a problem for a lot of pandemics that we're talking with that are not particularly COVID, but other kinds of pandemics. The only other, in terms of cause, I don't think anybody really knows. But there's a lot of parallels in that the people at risk for COVID are also the people that suffer the most in terms of environmental issues. It's also called environmental racism, so that because it's often race-based, and certainly in worldwide environmental issues affect Indigenous people far more than other people, because the exploitation, mining and other industries invariably is on Indigenous land, and they mistreat the people, and then they leave this big, huge pollution problem. And similarly with COVID, it's the Indigenous people, the racialized groups, the low-income people that are more at risk. The only other it's not really a cause and effect, but it's not so much, you don't hear about it so much now, but back last summer when people were saying, well, here, because of lower greenhouse gases, because of less air travel, people weren't traveling, people weren't buying, there's less consumerism. It was felt that this is now the time to make a clean break and start on a healthy way to look at our economy and restart with appropriate subsidies to appropriate industries. And a lot of this comes into the Green New Deal, which again, I don't think we should talk about because somebody else, it's a whole other hour, which I think will be really interesting. But otherwise, yeah, I don't know that there's much else that relates COVID to climate change, really.
Okay. So Jude, do you want to take over and read some of the questions?
Yeah, sure, Clark. Cathy, one of our questions is, was a comment actually. Excellent presentation. Is it possible to get a copy of your slides?
Sure, I guess we could put them on the 350 Kingston website. Could we do that?
Yep,
Yep, so I can do
that's
that.
a good idea. Yeah.
Fantastic.
And we should note that this is being recorded, right? So that will also be on the website.
And this is a question from me. How do you treat eco-anxiety, or is it inevitable and we're all going to have it?
Yeah, it's a good question because I mean, in some ways it's not any different from any other anxiety, except it's it's um it's something that we all share. So my personal view is that it always feels better um, to actually do something about it, being active, and there are many things that we can do, even small things, to feel like we're contributing to, say, reducing climate change, whether it's just in a personal level or working with an organization like 350 Kingston or whatever it is. I think that's one of the best ways to reduce anxiety, because you also surround yourself with other people that are being proactive, and that's very therapeutic.
Thank you. Okay, and a plug for us too. Okay, another question is readaptation. Doctors want double-blind proof concerning treatment. In other countries, a number of treatments for COVID are being tried successfully, such as IV vitamin C to reduce severity and duration. Do docs need to be more open to treatments found by observation to work as a way of adapting to new diseases such as COVID?
Well, I'm outside my area of expertise by far here, but I would agree with that. I mean, as long as there's, you know, I mean, high dose vitamin C has been used for many things. As far as I know, there's not great harm to it. I don't see any reason why that shouldn't be tried. There have been many examples of treatments that are not are not being used, and there are various reasons. The lack of randomized controlled trials, et cetera. But as long as there's no harm, or less, it's all a question of amount of harm, because COVID's pretty harmful too. So, I mean, there's some, like hydroxychloroquine was talked about early on, but there can be some severe effects of that. So you don't want to do, I mean, the mantra is do no harm. So it's a question of weighing risk and benefit. So, but I would agree that, I don't know those particular examples, but I do think in general, doctors in general need to be more open-minded about a lot of things, and perhaps that's one of them as well.
Thank you. Okay, this question starts with, great lecture, thanks. Climate change contributes to species depletion, and I understand that this increases the chance of zoonotic disease. If so, could climate change in part be blamed for COVID-19, directly related to viruses spreading from fauna?
I'm not sure. I can't remember. Is fauna animals?
Yes.
Yes, it's animals. It's flora and fauna. Yeah, this is what Clark was just mentioning. Yeah, it's possible. I don't know much about it. I know that we talked about this. People were talking about this through the spring and summer last year. I'm not sure that the feeling is it's anything to do with, I mean, they talked about wet markets in China and the pangolin and bats, and I'm not sure what the feeling is now, but I think that is, in terms of pandemics, it certainly is an issue, and certainly made worse by climate change. Perhaps not COVID itself, but other pandemics.
Mhm. Is there more research focus now on Lyme disease? Do you think a vaccine for Lyme is likely in the not too distant future?
I don't know, to be honest. I don't know much. I don't know. I haven't heard about Lyme disease vaccine too much. I mean, it's not on the horizon, but it would certainly, they have it for dogs, I believe. So I guess it would be pretty important for us to have it, and certainly in Eastern Ontario because it is endemic here. But I don't know. I don't know about the status of a vaccine.
What is the chorditis you mentioned that's caused by Lyme?
It's carditis. It's an inflammation of the heart. So it's usually manifested by heart blocks. So person might have sort of fainting. The heart goes way too slow. That's how it would present.
Wow, I did not know that. Question: are there examples of healthcare systems in Canada or globally that have been able to transfer to a more sustainable framework / energy source?
I think you're talking about greening the healthcare system. And there's been a lot worldwide about a lot of inroads about dealing, redesigning hospitals and particularly retrofitting. Building new hospitals, building new anything it's a given that you're going to be using, being very low ecological footprint, because that's the way we do things now. It's the retrofitting that's the issue. And some hospitals all over the world have been doing amazing things to reduce their carbon footprint, reduce their waste, reuse the water, things like, community garden right in the grounds of the hospital, recomposting the food, giving extra food to local food banks. I mean, there's all sorts of things going on worldwide that are pretty amazing in that sphere.
Okay. Oh, this is an interesting one. It's more related to 350.org. So maybe I'll skip that one. It's a question for what 350 policy is really. Okay, so it was mentioned that some people today choose not to have children due to the climate crisis. And we neglect to mention that people have done so for a long time. The damage of overpopulation and the impact it has. These are not new or recent issues. I guess I'm wondering how much we are aware of this having a historical dimension.
I don't know. I know that the number of children per family is much less now than it was 20 years ago. And I've read somewhere that something like 50% of Canadian families with children under 18 only have one child now. And I think that's different than it was 20 years ago. Again, I don't know, you'd have to look at some stats. But I hear about this more, and it's more just an anecdotal thing. I hear and read about young people saying this more than I used to.
Yeah, I know some of the climate strikers we worked with in their teens said that, especially the female ones.
Mm-hmm.
Yeah. Okay. The negative health effects are clear. From a local perspective, are we seeing any benefits from a warming, more extreme climate?
Any benefits in terms of health? I'd have to think about that. I mean, the winters are warmer, but we still have some pretty significant cold snaps for sure. I'd have to think about that. I can't think of anything positive health-wise. I know people talk about a longer growing season, and this would be adaptation, adapting our crops, etc., to having a longer, hotter growing season, and that is sometimes considered, I guess, a benefit. But in terms of direct health effects, I can't think of anything offhand.
Okay. Population may well collapse. Unfortunately, it will be after the climate collapses. When we see so much disease caused by lifestyle, example, diabetes, don't you think the medical profession has a lot to answer for?
About why there's so much diabetes? I'm assuming that's what the issue is. I don't know that this is much to do with climate change, but I think overall there has been not enough emphasis in the past on lifestyle. I see that as having changed quite a bit. But again, people are fighting against, industry where, and this gets into the corporate presence of, the sugar industry, et cetera, et cetera. And I don't think anybody could lay that on the medical profession as being their fault. It's a systemic issue for sure.
Yeah. I had heard that COVID-19 had been isolated from shrimp in the Wuhan wet market after the fact. Could it have arrived through the warming of the oceans and climate change? China fishes everywhere in the world, and they do eat a lot of raw seafood.
Sounds interesting. I have no idea. It's again totally outside my area of expertise. But that I hadn't heard about the shrimp. And all these are really interesting theories, but I don't know that anybody's really figured it out.
Yeah. Does anybody else have any questions you'd like to ask? If so, you can put them in the chat window. In the meantime, I could quickly talk briefly about that question that was directed at 350. Like 350 is a worldwide organization, and they do often run campaigns that recommend people vote a certain way. And through the 350 Kingston chapter, at one point we did discuss getting involved in elections, such as endorsing a certain candidate. But we felt that people would see us as less impartial. And so we didn't go through with it at that point, but it's something we might consider again. But yeah, I mean, it's almost time for everybody to get political because we don't have much time to turn this around. I don't know if you wanted to add anything to that, Clark?
No, but I do have another question, which is just at a local level. Cathy, you had talked about the political or systemic issues around climate change, dealing with climate change and government's responsibility. And I mean, clearly, federal governments in Ontario, the provincial governments have an important, necessary part to play in that. But I'm just wondering, at a local level, is there Kingston City Council at this point talks about being a sustainable city and trying to deal with climate change. They've declared a climate emergency. Is there anything at a local level that might help us to address some of these questions in a very immediate kind of way?
To be honest, I'm not sure. I don't follow municipal politics too much. But I mean, just things like, recycling, bike lanes, those kinds of things. They're usually municipal level kinds of things. One thing that people can do, though, municipal or any level, and I'm feel very strongly about this. This is all politics. Environmental issues, grassroots, are politics. things change at the policy level. They change at the legislation level. And as voters, we need to let our elected representatives know what we think. They tend to be reactive rather than proactive. If they don't hear otherwise, they'll think the status quo is just fine. So we need to tell them that the status quo is not fine. And we do that. We visit MPs, MPPs, we email, we call them, we write letters to the editor, those kinds of things. I've read, I don't know how true this is, that a politician, when they are contacted by a constituent about something, that constituent represents 100 voices. So when you do one thing like that, they're interpreting that as 100 people. So that's pretty powerful. And I think a lot of politicians are doing it because they really feel strongly about serving the public and they want to do the right thing. So I think even on a municipal level, those kinds of things go far. And those people that have the most trust, and this is where I get back to that bar graph about which professions are the most trusted, I think they should be doing more of that because they have influence that other people don't. Doctors' organizations generally are pretty conservative and stodgy, and they are getting much better, but they could copy the Nurses Association, like the Registered Nurses of RNAO, anyway, of Association of Ontario. Fantastic group of people. They are out there talking about climate change and pesticides and toxins and taking a stand, and that's the kind of thing we need. But anybody can do it. Anybody, and you don't need to be an expert in anything. You just get in touch with your local politician and say, these are the concerns, and what are you going to do about it? I think those kinds of things, again, at any level of government, are really, really helpful.
Okay. A diet with less meat is a win for the planet. How do you see the pros and cons of less meat from a health perspective?
From a health perspective, it's been shown that a plant-based diet is much better for you. Lower heart disease, lower obesity, lower cancer, and the other benefit is that it's easier on the planet, for sure.
Given widespread deforestation and industrial agricultural practices and their roles in zoonotic/novel disease emergence, are you concerned about more pandemics in this century?
I certainly would be, again, outside my area of expertise, but from what I've read, this is for sure an issue, whether COVID is related or not. There are other pandemics coming due to those things.
I have a question. The group that you mentioned, Physicians for Global Survival, are they focused on climate change, or do they take on many different issues?
Physicians for Global Survival the name is changed back to the Physicians for the Prevention of Nuclear War. So it's nuclear war. The other group I am still involved with is Canadian Association of Physicians for the Environment, which is it's a citizens group. It's not like a medical association. But the Physicians for Global Survival is worried about nuclear war. And to be perfectly honest, I mean, I'm not saying that climate change is not a problem. It's a massive problem. But I think if there is one threat to humanity, if I had to pick one, it would be nuclear war. At least climate change, we do have a few years. And if the planet is toast, it's going to take a while. Whereas with nuclear war, we're gone in 30 minutes. So I think they're both really important. But anyway, that's why I'm not involved really anymore. I wasn't on the board of that organization, but it's a very active organization that does a lot of good stuff.
Thank you. Do you think that after this global pandemic, there will be a better preparedness plan, not only on a medical level, but on federal level for pandemic response? Is there a plan to ensure adequate medical components and drug supply by producing these things in our country?
Well, these are all good questions. I am no expert on COVID or pandemics, but I certainly hope that we have learned a lot of good lessons from all of this. And unfortunately, sometimes we make the same mistakes over and over and over. So hopefully we will do it better next time and we'll learn from our mistakes. We'll also learn from the countries that have done this really well. And there are a number of them out there. In a lot of ways, Canada hasn't done it too badly. There are a lot of ways we could do it better. But if we look at a country like Australia, which has really done it well, hopefully we can learn from them and learn from our mistakes this time.
Thank you. Can medical associations somehow endorse the presence of food literacy in schools and participation in community gardens? I loved your reference to community gardens as a treatment for mental health. I've witnessed this in the field. Empowering youth to make change through such action is so essential.
No, I think it's a great idea to have it in schools. And I think it's a great idea for medical associations to promote that. I would agree.
Okay, people are writing a lot in the comments, a lot of good ideas in here. And references, books to read.
So we
Okay.
better save the chat here at the end of this and get other people to do the same thing.
Yeah.
Yeah. So if there aren't any other questions, maybe we should wrap it up and
One more if we want to have time for it.
yeah, okay.
Okay. I heard all the reserves of PPE from SARS-1 had been depleted by the time COVID-19 came along because it saved money to borrow from the strategic supply and no one had the budget to replace them. So a good question would be, will hospitals insist they maintain strategic supplies of PPE?
I don't know much about this, but it sounds like it's something we should learn from for next time and be prepared for sure.
Okay, and the last question. Do you think most healthcare practitioners see climate change as a threat to health?
I think they do. And I have to say, I am very, very inspired by young doctors coming along. Maybe the older doctors are not as in tune with this. Maybe they are, I don't know. But I'm the faculty advisor of the environmental advocacy interest group in the medical school. And then there's a new group in the family medicine, with the family medicine trainees on environmental health. And these are just such an inspiring group of young people. If I ever feel negative and worried and down about all of this, I just have to think of them. I meet with them occasionally, and they're doing different projects, and they are right on the money with all of this. And so I think we can perhaps end on a positive note that the young people coming up the ladder here, and in the medical profession, probably in all of healthcare, all the healthcare professions, they're on it, and they're moving, and they're active. So I think we're all of us will be in good hands.
Well, thank you very much for your thoughtful answers, and to all our participants for their wide range of questions.
Yeah, yes, I second that. Thank you, Cathy. That was really great. I'm just going to share the screen again and just talk about what we're doing next week. So next week we're going to have Kingston Secondary School student Isadora Ferguson, who is part of the Fridays for Futures group, is going to talk to us about youth and climate action. So if you would like to know what teenagers in Kingston think about the climate emergency, this will be your chance to hear what Isadora has to say and to ask her some questions. So till next week, thank you all for participating, and have a good evening.